Hi, this is Dottie Howe, the Communications Director at the Ohio Health Information Partnership, which manages the statewide CliniSync Health Information Exchange. Today we're going to show you a demonstration of our community health record, and I'd like to introduce Karen Bishop, our HIE Connectivity and Exchange Manager, who goes out with a staff of physician liaisons who actually show these demonstrations in practices, hospitals, especially most recently long-term and acute care facilities. This is the actual demonstration of how to navigate through the patient's longitudinal health record within the community health record. And here you can see results, face sheets, and so on. This longitudinal record accesses patient information contributed from more than 100 hospitals in Ohio and Kentucky. Now I'd like to ask Karen to show us a login page where you will go to the web portal.
Thanks, Dottie. Okay, so I'm going to go ahead and just launch my browser so I can go into our portal. So as you can see, this is a web-based application, so just how you would get into something else that is web-based. As long as you're at a secure browser, in a secure site, then you could go ahead and move into the product. So I'm going to go ahead and log in with my username. And my password, and anyone who uses CliniSync's portal will be given their own username and password. When they first log in, they'll actually be stopped at a EULA screen where they'll be able to read through the information and accept that click through EULA, as well as be presented with 3 challenge questions that they'll answer in case they need to change their password down the road.
Karen, can I just ask you, what's a EULA? And what does that really mean?
It's an end user license agreement. It's a set of terms and conditions that is available in most pieces of software or other types of applications that you use.
Okay, so they need to sign that, and then once they do that...
Yes, so basically by reading through, so there's a scroll bar, they'll scroll down to the bottom, and then the highlight of accept will occur. So when you first look at it, it's not highlighted, but when you scroll down the bar, then you'll be able to see the exception button, and they'll be able to accept that they have seen that EULA. So that's basically, it's not a paper signature, if you will, but just a click that your acknowledgement.
Okay, great, thanks.
Thank you, Dottie. Okay, so here we are on the very first page, or the welcome screen, if you will, once you log into the community health record. You can see here is my username, so any users logged in, they'll see their name there. There's also some other tools available within the community health record, like the results inbox, referrals, and messaging. So today we're going to focus on the continuity of care record, or the patient's longitudinal record within the environment. So I'm going to go ahead and list the patient's name I'd like to search, and you can see here that it suggests you enter the name, MRN of that particular contributing facility, SSN, or date of birth. So today we have over 6 million unique patient records out there. So as you can imagine, the more specific you can get when looking up your patient, the better. So I'm going to go ahead and enter my test patient here. So my first name of my patient is ADT4, so you put a space and then the last name, and now I'm going to go ahead and enter the date of birth to go ahead and pull that search criteria down a little bit more. And then when you put the year in, it does have to be the full 4-digit year. So I'm going to go ahead and click on search. And it's looking through a lot of records there, so it's trying to find the patient that matches my criteria. Okay, so I see my patient here, so I need to select my reason. And there are a variety of reasons here. So administrative might be if you were just simply consenting the patient in. Clinical non-emergent would be if you were looking into the record to perhaps maybe you're a staff within a physician's office and you're preparing some charts for the physician to visit the patient, and you may want to go out there and see if there's any new results. So that would be a scenario where you would use clinical non-emergent. And then the last one being create a referral. So I'm going to go ahead and click on Access Additional Records now. Okay. And there's my patient. And I can validate that this is my patient with my date of birth here, the social security number, the last 4 digit, and the contributing facility, as well as patient gender. So I'm going to go ahead and click on this patient's name. And I know that they have consented into the patient because I'm taken right into their record. If they were not consented in, then I would be shown the consent screen, which we'll show you here in a moment. So when I look at my patient's information here, you can see across the top there's last name, comma, first name, gender, age, date of birth. If the patient had been readmitted within the last 30 days, you would see an icon here that is red to let you know that that had occurred. And this is the MRN from this particular facility that I clicked to pull up. However, all of the patient's information will be contained within this particular record. And then you can see here how I've accessed the record. Let's just go ahead and continue to move across the top of the screen here, and let's use this first function for creating a care summary. So I'm going to go ahead and click on that, and I'm taken into a type of a wizard here. So I'm going to go ahead and just leave the information here as suggested, and then I'm going to click on preview. So what the system is doing right now, it's going out, it's capturing all that information about that patient. It's pulling it together in one singular document, which is called a summarization of care, or a CCD. Well, so I can go ahead and scroll down through this patient's information. As you can see, there's a table of contents and then anything that was contributed on that patient. And this is a test patient, so there's not a whole lot of information on there, but I think you can imagine if a patient has had several visits within Ohio, then you might see many, many pages. Yeah, so a nice thing that you can do with this particular summary of care is you can download it, and it was downloaded in a CCD format. So if your EHR is able to pull in those CCD documents, you'll be able to pull that into your system. A good use case for that, perhaps you were referred a new patient from maybe a local emergency room, and you have not seen the patient previously, so you might want to collect information on that patient and pull it into your EHR for treatment. And you can also print to your local printer, or you can print a file which will create a PDF. So if your EHR perhaps has scanning capabilities, then you could always scan that within. Now you will notice here that the Documents tab highlighted. What that means is once I create these care summaries on the fly within the community health record for this particular patient, they temporarily store under this Documents tab. Now once I navigate away from this patient and pull up my next patient, then those will disappear. The reason why they're only stored there temporarily is because the next information that comes in on that patient, it will change this. So that's why it's not stored long term. Okay, so we're going to go ahead and to move into our profiles and face sheets. So I'm just going to click on that button there. And you'll notice the first tab is demographics, and we just have one contributing facility for this test patient. If there was multiple, we could use our down arrow to navigate in between the various demographic contributions. So just a basic demographic screen here. One thing to note all the way at the bottom is the patient consent. This will actually let you know when the patient consented into the health information exchange for their records to be shared. Okay. And as you'll notice here, we can print that to our local printer or print file if we need to scan that in. Okay. And our next tab here is the Face Sheets tab. So again, just one has been contributed for this test patient, but if there were multiple contributors, then I could use my scroll bar and navigate through the various contributors. So again, with the face sheet, you still have that demographics, but you also have a little bit more information about that patient and their visit that you didn't have in just the basic demographic screen. Okay, so let's go ahead and navigate over to the patient summary. And when using a community health record, it's best to use the buttons when you can. Using the back arrow does not always give you the desired results. It might go back to a screen that you think maybe it should have went back further. So it's always best to use the buttons. So I'm going to go ahead and click to go back to the patient summary. So within our patient summary screen, it really does two things. So it launches you in to these additional areas here within the patient's record. It also shows the last three most recent. So if you're maybe looking for the most recent result, of course you could get it right here from this screen, but it would just be the last three. If you wanted to drill into the full result screen, then you can click and it'll actually just drill you right into there. So we'll click back to patient summary here. So you can configure this screen. So it's basically a sticky setting for the user logged in. So here under the configure, you can go ahead and click on it here. Perhaps maybe you want results to be at the top, so you can just grab and move things around, or maybe you know that you won't be looking for maybe a report or something. So you can move it down into the hidden sections and you can just save that. And again, that is a sticky setting for the user signed in, so everyone's screen would look the way that they would like it to.
Karen, do you use that for every single patient, or does that become like a default?
It becomes your default, yes.
Okay.
Okay. And then as you can see here, I'm showing all. You can also use these filtering criteria to kind of drill it down a little further. Okay. So there's some of the other information that you would see there. Again, this is the test patient, so not tons of information on there, but you would see any contributed procedures and reports, anything like that. And then you can also see that summary of care that I created. So when I click on this, it would take me right into the Documents tab. Okay. So we'll just go ahead and move back to the patient summary. And then one thing most people like to see, of course, is encounters. And results. So let's go to our encounters first. We can go there here by clicking, or we can just click over here in the bar for encounters. So when I scroll down here again, if there would have been any problems that had been contributed for this patient, I would see them there and would be able to click on them. Likewise with the encounter history. So I'm going to go ahead and click on that to pull that up. You notice I can also click here to pull that face sheet as well. So I'm going to go ahead and click here to see those encounter details. So it's very similar to the continuity of care document that we created, but this is based just on a singular visit, so a lot less information. But we can also create it so you would be able to download it as a CCD within your EHR if it's capable. So to do that, we're just going to go ahead and click on Encounter Summary here. And you'll notice that it displayed under the Documents tab for me. You'll also see a similar table of contents, but there again though, it's just isolated to that one specific encounter for your patient. So again, all those will be dependent upon the information that was contributed from any of the contributing facilities. Same situation here. We can click to download, which downloads into a CCD format that we can pull into our EHR. We could print to our local printer or print a file if we need to scan it in. So the next thing that we'll do is we're going to move into our results. So I'm going to click on the Results tab. And under Results, you have some of the similar filtering options, as well as you can utilize the date range, high and low dates. Now these are not sticky settings, meaning that each time you look for a new result, you'll need to check mark if you would like to add any filtering criteria. And one item to note here as well, you'll see the trans feed here. If you're looking for a discharge summary, an ED summary, an ED part summary, those, the way we're situated, those will come through the transcription feed. You might think that, well, they should be under the documents, but the documents is for those CCDs that we created on the fly, or the encounter summary that we created on the fly, as well as any contribution made by local practices, long-term cares, things like that is what you would see there.
So Karen, under documents, if someone else contributed a CCD, would that be there?
Yes.
And that would permanently be there?
Correct.
Okay.
Okay, so let's go ahead and drill into one of the results here, so you can see a little more information about the result. So as you can see, it gives all the detail about the result. If there were any abnormal or critical values, they would highlight red and bold to kind of draw your eye in. Okay. And again, with the results, you can print those or print those to file. Okay. And I can either click here or I can click on return to results to get back where I was. So definitely when you utilize the system, you want to be using your filters for these results. As you can imagine, over time, there'll be many results for a patient, and just to kind of help with the usability of the system, get used to using those filters so you can really drill into the information that's most important to you.
And I think one of the advantages of this tool is that it does allow you to filter that, because depending upon the kind of doctor you are, your needs will change from specialty to specialty. So you don't want to have all the information all at once, which has been in the past a complaint by physicians, and this tool actually allows you to filter so you don't have to see everything.
Absolutely. Good point, Dottie. And especially too with a preliminary, some folks might not even want to see those prelims. They might want to drill right into finals. Okay. So the next item we're going to move into is medications. So when I click on medications, today we are not receiving information from pharmacy system, Mars, or anything like that. So to look for those discharge medications, you'll need to go under your results screen and pull those transcription reports that are labeled discharge summaries.
But the medications will be coming. That part of the tool will be coming in the future.
Yes, we're currently working with ORS to have a link within this tab where you'll be able to query the ORS database for Ohio as well as border states, with the exception of Pennsylvania, which does not have one currently. We're also, as Dottie mentioned, we'll be working with SureScripts to have that information available as well. But today, when you use the system, allergies would be the big thing that you can see here. So on our patient summary screen, if you'll recall, we saw the most recent 3, but all of them would list here. So as you can see, it defaults at 5 and 10, or you could select all. So that's would be some reason why you would go to the screen, would be to pull those allergies up. Okay. And then within the last tab here is our documents. So again, the only thing that I have in here on my test patient are the 2 items that I created on the fly. So I did my summary of encounter and also the full summary of care, which was that full view of the patient's longitudinal record. So the next thing we're going to do is we're going to go ahead and show you how to consent a patient in. So I'm going to look for the same patient again, but I'm going to remove this date of birth. Okay. And as you can see, here's the patient I was just on. I'm still going to go into clinical non-emergent to access additional records. And now you'll see I have another patient here as well. So although the patient name is the same, first name and last name, which I'm sure that you will see quite a bit for very common names, you can see that the date of birth is different. Okay. So I'm going to go ahead and click on this patient because I need to see their record. And I am presented with an express consent screen. So part of our onboarding process is to teach any user of the community health record how to gather consent. if you'll be drilling into the patient's record. So one thing you would need to do before going into a patient's record, if they have not already consented in, is you would need to gather consent before consenting them into the HIE. So as you can see, it's a screen that will pop up right away, so you just cannot get into the record. So if I didn't have the paperwork on file and I can't hit continue and go into the record without doing that, my only option is to cancel. I also can't remove this to not do this process. So we're going to go ahead and click on continue. And here's why I will opt the patient in. As you can see, it's default opted out, so I definitely need to make sure that I click on that opt-in patient there. You can see here that they're opted out by default, which means that their data was contributed and they just have not had an opportunity to make a meaningful choice about their consent status. So all I do now is I click submit, and I'm taken directly into the patient's record. And that concludes this portion of the continuity of care record within the community health record.
Well, thank you very much, and I wanted to also let you know that we have various modules of this series on the community health record that you can access that will go into consent and other areas, but I just wanted to let you know that this just one is the demonstration. Please feel free to access the other ones on YouTube. It's published on our website, which is www.clinisync.org. Thank you.